A prescriber diagnoses a complex condition and clicks Submit on an order for a specialty biologic. The patient leaves the office, and the clinical encounter is marked as complete. 2 weeks later, the medication remains at the pharmacy. The patient walked away because the out-of-pocket cost was $800, a figure no one in the practice could see at the time of prescribing. According to data from IQVIA and Playo, this isn't an isolated incident. When the patient cost for a specialty medication exceeds $250, 70% of patients simply abandon their treatment. This loss of treatment creates a clinical failure that converts into a financial one, as the abandoned prescription begins to impact the practice's revenue cycle. Sending a prescription without coverage data forces the system to handle the fallout retrospectively. One front-end blind spot triggers a sequence of administrative failures that move from the exam room to the billing office. Staff become trapped in a retrospective queue, managing complex prior authorization requests that MGMA research shows take an average of 35 minutes each to complete. This graph tracks the ultimate consequence. Initial claim denial rates rose to 11.8% in 2024, with revenue cycle leaders identifying missing front-end eligibility data as the primary driver of these rejections. When we quantify the damage, these preventable denials cost the average provider $8,700 every single year. Managing specialty drugs without real-time data ensures that the practice loses both its clinical goals and its earned revenue at an unsustainable rate. To bridge this gap, many organizations are turning to Real-Time Benefit Check, or RTBC. RTBC is a decision support tool that connects to the patient's plan at the moment of prescribing. It surfaces specific out-of-pocket costs, prior authorization flags, and lower-cost alternatives in seconds. This chart illustrates the potential savings. SureScripts reports that using RTBC to find covered alternatives saves an average of $817 per specialty prescription. Despite these clear clinical advantages, execution remains a struggle because of the sheer complexity of the workflow. Managing this in-house requires staff to jump between dozens of payer portals, each with unique rules for specialty tiers, while simultaneously handling phones and patient check-ins. The overhead is significant. Hiring and training a single, fully loaded in-house verification specialist costs an average of $77,000 per year. For most practices, building this level of specialized expertise in-house creates an operational burden that outweighs the benefits. Smart practices are shifting their approach by outsourcing this specific eligibility function to Staffingly. Staffingly provides dedicated AAPC-certified specialists who work directly inside the practice's existing EMR every day, managing the entire RTBC and verification process. Staffingly integrates AI to identify optimal routing paths for each payer and automatically surface copay assistance at the point of prescribing. AI handles routing, but human specialists manage exceptions, intercepting payer-specific edge cases that automated systems miss. The team runs batch eligibility checks against the full schedule overnight, identifying coverage gaps before the first patient of the day arrives. This technology-enabled human workflow catches the clinical failure before it reaches the pharmacy, moving past the limitations of simple software. The operational shift is immediate. Per-patient verification times that often exceed 30 minutes in-house drop to under 90 seconds. High-speed verification improves accuracy. Practices see a 60 to 80% reduction in eligibility-related denials, with error rates remaining below 1%. The economic shift is measurable. Practices can replace a $77,000 annual salary with a dedicated specialist seat at $399 per week. Outsourcing this workflow has become a deliberate cost management decision currently utilized by over 800 healthcare providers. Transitioning to an outside team requires a foundation of rigorous security to protect patient data. Staffily operates under SOC 2 Type 2 and ISO 27001 certifications. They maintain HITRUST alignment and sign a business associate agreement before any work begins. To prove the efficacy of the model, the engagement starts with a 14-day risk-free pilot program.